each of us here is passionate and proactive about making a meaningful difference. The expansion of One Door initiative is a testament to that commitment. By offering access to comprehensive services in a location that is both familiar and convenient, we are already seeing tangible results. Just last Monday, 11 patients had their Medicaid application approved within a single day. That is impact. Impact on those 11 members, their families, impact on Heart of Ohio, impact in the city, and impact in our community at large. This is how change happens. 60 years ago, the community health center movement began with a vision of health equity and health access for all. Today, initiatives like One Door ensure that this journey continues and that the quality of life for our residents continue to improve. Thank you for allowing our home here at Heart of Ohio to be a place where One Door is always open to those in need. We eagerly anticipate opening another door at our Capital Park location on Innis Road in a few months. Now it is my pleasure to introduce one of the visionary leaders who helped make this possible, a tireless advocate for advanced healthcare in Franklin County and beyond. Commissioner Kevin Boyce has long championed the kind of transformative change we celebrate today. Thank you, Commissioner Boyce and your team, for your unwavering commitment to turning dreams into reality.
Thank you, Dr. Muhammad, for your leadership, not just here today, but for quite some time. We were reminiscing about getting to know each other over the years, and I'm just so grateful to have you as part of this community and to be able to call you my friend. I'd also just like to take a minute to recognize a few other people who have joined us today who may not be a part of this particular project, but in one way or another play an important part in the ecosystem of providing services to our residents. Let me just start by acknowledging Dr. Saleshi with ETTS. Give him a round of applause for himself. Rochelle Pride, who's with our economic development group. Give her a round of applause for me. One of my favorite people in all of Franklin County, our DCA, Joy Bibbins. She's at the heart of all of this stuff. I see our Health Commissioner Joe Mazzola is here. Thank you so much for what you do. And then I think I saw Chip spinning somewhere. Did I see Chip? Yeah, Chip's back there. Give him a round of applause. We're going to hear from my colleague John O'Grady, who has also been a major champion in ensuring that our residents have the resources they need. And I know that Commissioner Erica Crawley couldn't be with us here with us today, but I know I speak on her behalf, and so does John, when I say thank you on her behalf to all of our partners and all the players who are part of helping us to build this ecosystem. I'd be remiss if I didn't acknowledge two other people here. First, we're in the city of Whitehall, and you can't be in the city of Whitehall and not recognize the great Mayor Michael Bivens. So grateful for your leadership and your friendship, not just with me personally, but with Franklin County. Thank you. And then I've got shadowing me today, State Representative Meredith Lawson Rowe, who she wanted me to know. She said, Commissioner, this is not my district. This is actually Representative Humphrey's district. But she's shadowing me today because she's a serious politician. She wants to understand how Franklin County and the state of Ohio can work together. And so this is a great example of how we partner with our communities to do that. So thank you so much for shadowing me and being here with us today. Oh, I'm sorry, just one other group. Let's recognize the board of Heart of Ohio. Stand up to be recognized. Come on, be recognized. Thank you so much. I should know, Dr. Muhammad asked me to recognize you guys. He asked me, he said, hey, can you recognize my board? So I'm just saying. Hey, Dr. Muhammad. And so it's important to recognize all the partners that are joining us here today. People who wake up every single day committed to serving our residents. It's important to recognize that we're all in this together, and we're truly honored to be here as we celebrate the opening of Heart of Ohio One Door Branch. For too long, that's right, you can round of applause together. For too long, getting help in our community hasn't been easy. Residents have had to navigate a maze of offices, repeat their stories again and again, and face countless obstacles along the way. The reality is, many of our neighbors need support from multiple agencies at the same time. In fact, 43% of eligible residents require services from 2 or more Health and Human Service agencies, often when they walk through our doors. That's exactly why we created One Door, to create a one-stop shop to serve our residents every day. Today, we celebrate a new chapter in that effort. With this branch here at Heart of Ohio, right here in Whitehall, a community where they have nearly 30% of residents who rely on Medicaid and healthcare resources from us as well. I mean, that statistic alone underscores the importance of accessible, integrated services that meet our neighbors, most importantly, right where they are. This federally qualified health center already serves families across Central Ohio through 6 locations. And now, with One Door under the same roof, residents can access a wide range of critical services all in one place. SNAP, TANF, Medicaid, senior programming, adult protective services, kinship care, senior housing, child support services, and resources for justice-involved residents right here under one roof. One Door isn't just about convenience. Most importantly, it's about impact. In Franklin County, over 54,000 households, that's families, seniors, and hardworking neighbors, are spending more than 30% of their income just to keep a roof over their head. That's tens of thousands of people living on the edge and one unplanned expense away from losing their home. Food insecurity, I know Commissioner Brady has been a huge champion of addressing our food insecurity issues, and gaps in healthcare persist. Our county currently ranks 63rd out of 88 counties in Ohio for overall healthcare outcomes. Our One Door model can change that. By connecting residents to emergency housing support, food and nutrition programs, Commissioner O'Grady, mental health services, and preventive care, we can make sure that our families are not just surviving, but thriving. And here's what's most important about One Door. Instead of bouncing around between offices and repeating their story at every turn, residents can get collaborative case planning, comprehensive assessments, and most importantly, seamless referrals all under one roof. They get the help that they need efficiently and with dignity. Whether it's through the Office of Aging, Jobs and Family Services, Justice Policy and Programs, or Child Support Enforcement Agency, One Door creates a clear, unified path to their success. This initiative reflects a larger vision for Franklin County, one where equity is not just a word on a page, but a commitment in practice. One where we meet residents where they are and provide the tools that they need to seize the opportunities and reach their full potential. And let me say this, you can't go anywhere in Central Ohio without seeing cranes in the sky and orange barrels on the streets. Our community is growing, and the growth is exciting, no doubt. But as we grow, so does the gap for some of our residents. And that's why initiatives like the one that we're celebrating today are so important. One Door at the Heart of Ohio isn't just a service center, it's a new way forward. It's a place where residents can walk in with confidence, knowing that support is waiting for them on the other side of that door. So thank you, Dr. Muhammad, and all of our partners who are here today to make Franklin County more stronger, more healthier, and most importantly, more equitable for all. Today isn't just about cutting a ribbon. It's about opening the door to a new opportunity. It's my pleasure to share with you my partner in this effort, Commissioner John O'Grady.
Good afternoon, everyone.
Good afternoon.
So, Dr. Muhammad, thank you. I stood up and shook hands with the mayor, not simply because he's the mayor of Whitehall and welcomes us here to his city, but he also has the finest bourbon collection. Not just in Whitehall, but one of the finest ones in Franklin County, so have to pay respect. I also, Dr. Muhammad, I also want to say thank you for having us here today, and say thank you to your board, not just to your board, but to one particular member of your board, Ms. Greta Russell. For those of you who don't know, and I'm sure most of you don't, or maybe none of you do, but Greta not only is a longtime friend of not only mine and my wife, dear friend of mine and my wife, but Greta was my original campaign chair. Campaign finance chair. So I have to say a personal thank you to Greta, because I would not be here today after all these years as an elected official if it wasn't for Greta being willing to be my finance chair of my campaign. So personal thank you to her. So thank you very much. And thank you, Commissioner Boyce. And I appreciate you doing all the thank yous and shout outs to everybody. That's the hardest job usually that anybody has to do. So thank you for doing that. I didn't have to. But I appreciate being here this afternoon. I'm honored to be with all of you. When we gather for events like this, it's usually about more than just a ribbon cutting. It's about turning a page in how Franklin County serves its residents. This isn't simply a new office or just another program that we are celebrating here today. It's a part of a broader vision for how government works, and how, when government doesn't just transact business here today, we transform lives. One of the most important responsibilities of county government is to ensure that residents can meet their basic needs and access opportunities to build a better future. That's why back in 2018, my colleagues and I launched a countywide effort to better understand poverty in Franklin County. We listened to residents, advocates, and service providers, and what we heard was very clear. To many families, they were forced to navigate a maze of agencies and offices and paperwork just to get the help that they needed. Those voices shaped our Rise Together blueprint, what we call the People's Plan. And at the heart of that plan is a commitment to simply access essential services to meet residents where they are, and one door is that promise in action. This initiative is about breaking down barriers. It's about neighbors helping neighbors, and it's families that shouldn't have to jump through hoops or travel across the county for help. Claire and I just drove out here from downtown. It's getting to the complex downtown, getting into the courthouse downtown. I've been down there for a long time. I've been going to the courthouse myself, every day for a lot of years. And getting into the courthouse complex is not easy. It's never been easy. I've been complaining about it to county administration for a long time. It's not easy for our residents to get in and out of the courthouse complex. And so having a facility like this one is, an unbelievable godsend to our residents. Frankly, we need more to them. So this initiative is about breaking down barriers. And so that's what we're here to do today. So that's what today represents. It isn't just a convenient location. It's a symbol of our philosophy. We believe Franklin County should be a place where opportunity is real and within reach for every resident every day. We say that a lot. That's our motto, every resident every day. But we believe it. We absolutely believe those words, every resident every day. An opportunity doesn't happen by accident. It happens when government is intentional about how it serves its people. When we move away from a model of transactions and toward a model of transformation. That's why I'm so proud of the partnership with Heart of Ohio Family Health to bring One Door into this neighborhood. It reflects not only our history of innovation, but also our vision for the future. Continuing to do business in a way rooted in dignity, equity, and opportunity. Now it's my pleasure to introduce somebody who doesn't really need an introduction, but has been at the forefront of this effort, our Deputy County Administrator for Health and Human Services, Ms. Joy Bittens.
Good afternoon, everyone. I know we acknowledged everyone, but I know my boo is in the room, so thank you, Mr. Mayor, for all that you do for the city of Whitehall. And thank you to the board, but I really also want to make sure that I thank the JFS team. Can you raise your hand if you were with, I'm sorry, the county HHS team. If you were with the county, would you please raise your hand and just thank you all so much. Thank you for working so hard on this. I don't know where you're at right now. Thank you always for working so hard on this. Thank you. And thank you, Yama. I know we've been very difficult. So thank you, Ms. Yama. You all need to give her 5 raises. So just really quick, I want to touch bases on One Door. One Door came out of, like Commissioner Brady said, the Poverty Blueprint Plan. When we were doing those conversations with residents, one of the things I did was I shadowed our residents that were walking to one of our JFS. There was a mom that walked in and the worker was at the desk and she called her number. She walked over and gave her a number, and the woman handed over an obituary. And so because I was standing behind her, I intercepted it and I looked at it and I said, "Is this your son?" And the woman coupled over the desk and started crying. And so I went to grab her and have conversation with her. And what she told me was, yes, my son was killed. He was killed by gun violence. He was 15 years old. I said, well, let me see, I'm trying to get him off my case. I'm trying to do all these things. My mom is in the car. I take care of my mom. I got to get back to work. And in that moment, I knew we needed to do something different. Health and Human Services needed to change. It needed to change for everyone. Because imagine her telling that story to every door she walked in. It's traumatic, right? Mm-hmm. It's traumatic to hear. So I have some of the dopest commissioners on the planet. And they are so dope. One of them even gave me the name of DCH Ching because they feel like I spend all the money. And I don't. I really don't, right? So I went to them and I said, okay, out of the Poverty Blueprint Plan, the People's Plan, one of the things the folks said that they wanted something they can walk into and get all the things at one time. And so as we adopted this model, we implemented downtown our government center. The reason why we adopted it here, I originally looked at Capitol Park because I was scoping out the real estate there. I was like, I said, I see Dr. Muhammad. I said, no, you wonder why I'm stalking you. I said, you have some empty cubicles over there that I think we can utilize, right? But one of the reasons why we're starting this in our in this clinic is because we want to test the model. Imagine walking in, being able to pick up your prescription, but also you need a rent for your grandmother. Imagine walking in and seeing the doctor for your medical services, but at the same time, you want to make sure you have a workforce opportunity or check on your food assistance case, or whatever you can be provided in our brick and mortar. It eases access, releases burden, and reduces stress. Our Franklin County Commissioners are committed to every resident in every part of this county to ensuring that we are not just providing the resources as it is mandated by the state or whoever, but also making sure that we're doing it in a dignified way and that we are moving people up the economic mobility ladder. I cannot be more proud. I am so happy. This is personal for me because I want to make sure that it doesn't just start here, but it starts, we duplicate this across the county and other places. And it doesn't hurt that you have 21,000 patients that that supports the reason why I could place it here, Dr. Because some people were like, well, can you, I said, you got 5 people. I said, you gotta be high traffic. You gotta be a high traffic area. But I do wanna make mention, there are some federal changes that are ahead of us. We have some tough challenges ahead of us. These Board of Commissioners have some tough challenges to make in the days ahead as it relates to budget. Resources like this, one door being infused into a healthcare system, will assist many residents so that as they are making those decisions, there's more ease and folks do not fall through the crack. So we are excited. This is our first partner outside of the county government. I know we're going to Capitol Park because there's still some real estate over there. I do know we did provide a case manager over at Primary One as well for their Medicaid services. Hopefully one day we can, duplicate those services there as well because they have the number of patients as well. So again, thank you all so much. Thank you for believing in the vision. Thank you to my dopest commissioners on the planet, and I didn't spend any money. Did I spend any money, you all? But it's coming, Commissioner. Thank you all so much. And I think who is leading the ribbon cutting? Because I know it is not me. Is it you, Dr. Mohammed?
I think it's
Terry. Terry. Oh, you're not doing it? You're just moving it. Who's gonna cut? Who's gonna be the MC for the ribbon cutting? Commissioners? Is there actual ribbons now? Oh, there's ribbons.
scissors.
This is a real situation.
We're gonna do a few.
Board members.
Board members, commissioners.
Board members. Yep.
Well, eventually.
But we can share, we can share. We can share.
We can share and we can cut several ribbons.
Yeah, we can
Come on, guys.
Board members. Who wants to hold the pair of scissors? Who would like to hold them both?
Come on, Greta, come hold scissors with me.
Ready, go with your boyfriend there.
Yeah, come on over with your boyfriend.
I wanted to hold that with you.
We can share.
You and Gloria share.
They have another one back here.
Okay, we're gonna do this on the count of 3.
Let's count to 3. You got it?
On the count of 3. 1, 2, 3.